got that new Zoom link. So I'm just going to wait a few more minutes.
So Steve, the stream is going live now, so whenever you guys have quorum, you can feel free to start.
Thank you, David.
Welcome.
Tamara, we have quorum if you would like to start the meeting.
Perfect. I was just running through counting everybody. So thank you, Steve. All right, everybody. Good afternoon. Welcome to the Continuum of Care board meeting. Let's call the meeting to order. My name is Tamara Wright, board co-chair. I am with Community Solutions, and we have a very full agenda today. I will now commence with a roll call of each board member's name and ask you to introduce yourself and your organization. And I'll start with Sergeant Rob Ferraro, board co-chair. Rob, are you on? Eric Cole. Eric, are you on? I thought I saw you earlier. Maybe you're muted.
He had to run and grab something.
I think you're muted.
There we go.
Yes, we hear you. Perfect. Thank you.
ASU Watts College. Sorry about that.
That's all right. Ryan Balch, are you on? City of Chandler? Okay. Elizabeth DaCosta?
Elizabeth DaCosta with Community Bridges.
Thank you. Marshall Franklin?
So good afternoon, everyone. I apologize. It shows 043156, which is my employee ID number, but it's Marshall with the City of Phoenix. I don't know how to change it from my employee ID number because we use WebEx. So just know 043, if I happen to go off video, is me. And then I do have to apologize. I will have to step off right at 2:45 due to another commitment. So hopefully that will not mess up our quorum. Thank you, everyone.
Thank you, Marshall. Do we have Tad Gary on?
Yes, this is Tad Gary with Mercy Care.
Thank you. Samantha Jackson?
Yep, Samantha Jackson, Downtown Phoenix Partnership or Incorporated, just pick one.
Thank you. Bruce Liggett. Bruce, are you on? Joan Service?
Joan Service, Arizona Housing Coalition.
Thank you. Charles Sullivan?
Charles Sullivan, ABC Housing.
Thank you. Jackie Taylor? Okay. And Dee Dee Yazzie Divine?
I am here. Thank you.
Hi, Dee Dee. Thank you. I will now call on COC MAG staff and ask them to introduce themselves. Steve Dudasik?
Hi, this is Steve Dudasik from the COC MAG. Good afternoon, everyone.
Thank you, Steve. Sarah Kent?
Good afternoon, everyone. Sarah Kent is here.
Thank you, Sarah. Tina Lopez?
Hi, everybody. It's Tina. Thank you.
Hi, thank you. Brandy Mead? Julie Montoya?
Good afternoon, everyone. Julie Montoya here.
Hi, Julie. Thank you so much. In addition, we have guest presenters today. When I call your name, please introduce yourself and your organization. Jeff Olivet.
Hi, good afternoon, everybody. I'm Jeff Olivet with Racial Equity Partners and based most of the time in Cambridge, Massachusetts and Washington, D.C. It's nice to be with all of you today.
Thank you, Jeff. Do we have Donald Whitehead?
Yes, Donald Whitehead, the other part of Race Equity Partners. I am based in Laurel, Maryland and Washington, D.C.
Thank you so much. Jeff Wilgell.
Hi, Jeff Wilgell here with the Phoenix VA.
Thank you. Melody Boyette. Or Boyer.
Melody Boyer from the Phoenix VA.
Thank you. Amy Schwabenlander.
Amy Schwabenlander, Human Services Campus.
Thank you, Amy. Did I miss anybody?
Bruce Liggett is on.
Ah, Bruce, thank you. We gotcha. Okay, for all participants, please mute your phone or your computer when speaking, and please do not put your phone on hold. For all participants, we ask that you identify yourself when speaking, and we will be reminding people to do that throughout the meeting. As we have been advised, this is very important for open meeting law. An additional agenda item was added for today's meeting. Item 10 will now be on the topic of Human Service Campus request for shelter beds. And one final housekeeping item, all votes will be roll call votes. I will call the roll after the motion is made. And was Rob Ferraro able to join us? If not, I will now go to item 2, the call to the audience. Please note that members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov/comment within 1 hour of the posted start time of the meeting. Were there any comments received?
No comments were received. No written comments were received.
Okay, thank you. Additionally, members of the public are now given the opportunity to ask to join the Zoom link to make verbal comment. Please note that verbal comments will be limited to 3 minutes. We received one request for verbal comment and we'll accept it now. Please introduce yourself. I believe that's Darlene Newsom.
Yes, Darlene Newsom from UMOM.
Hi, Darlene.
Good to see you all.
Awesome, thank you. All right, we'll move on to item 3, approval of the consent agenda.
I'm sorry, Tamara, I'm sorry. Darlene, are you commenting on an action item or are you just making a general comment on an agenda item? The way we're doing this on Zoom now would be like a regular board meeting that if you're making a comment on one of the agenda items that's not up for action, you could make it now and we'll look at it, during that agenda item as well. Thank you.
Right. Well, I'm not sure until I hear the presentations on the different items, but I did want to comment on the shelter item by CIR. Is that still on the agenda?
Yes, it is.
Okay, but I wanted to wait. I'm not sure.
Okay, Tamara, would that be allowable?
Yeah, that's fine.
Okay, just trying to maintain protocol. Thank you.
Thank you, Steve. Thank you, Darlene. All right, moving on to item 3, approval of the consent agenda. So next we have one item on the consent agenda. It's the approval of the minutes from the August 24th, 2020 board meeting. Is there anyone on the board who would like to request that an item be removed from the consent agenda and considered as part of the regular agenda? Okay, any comments from the board on the consent agenda? Okay, do I have a motion to approve the consent agenda? And again, please identify yourself.
This is Dee Dee. I make a motion to approve the consent agenda as written.
Thank you, Dee Dee. Do I have a second?
This is Tad, second.
Thank you so much. And I'll proceed with a roll call. Rob Ferraro? Not on yet. Eric Cole? Elizabeth DaCosta? Marshall Franklin.
Yes.
Thank you. Tad Gary.
Yes.
Samantha Jackson.
Aye.
Bruce Liggett.
Aye.
Joan Service.
Aye.
Charles Sullivan.
Aye.
Jackie Taylor. Dee Dee Yazzie Divine.
Aye.
All right, the motion passes. Was Rob able to join us yet? If not, I will move on to item 4. Okay, I'll move on. Item 4 is racial equity. I would like to welcome Jeff Olivet and Donald Whitehead from Racial Equity Partners, who will provide an update on their racial equity project with our Continuum of Care. And I'll leave it to you guys.
Well, thank you very much. And we are very pleased to be able to present our initial findings. We also want to just give a very appreciative thank you to the members of the work group who have been extremely helpful, engaged, and just provided a real welcome environment for us to continue this work. So you'll see on the screen the members of the work group. Some of you are on the call now. Other people that are on the call helped us in different ways. And we first, before we go on with anything, we want to just really acknowledge the participation, the level of expertise, and all of the many wonderful actions that this group participated in. So with that being said, I'll just, for those of you who weren't a part of the process, we're going to go through our process, the assessment process, and also some of our findings afterwards. So we'll start with the assessment process, which was during the period of March through July. We did a number of focus groups. The first focus group, or one of the focus groups, was with people of color who experienced homelessness in Maricopa County. We worked with single adults, we worked with some families, and we also worked with a youth group. And we went through a series of really insightful focus groups with those individuals. We really were enlightened by some of their comments. And actually their comments were really in line with what you'll see in the survey that we'll look at a little later, and also from what we got from a lot of you in the next part of the assessment, which was the individual and group interviews. Again, I thank you all for being a part of that. I think you were really, you really did a great job in identifying community stakeholders, which were really able to give us a very deep look into the issues within Maricopa County. A lot of you participated in that as well. We got some really comprehensive feedback from that really kind of moved us in the direction that we came up with. There was the online provider survey. We got over 200 responses from that. And we gleaned a great deal of really valuable information from that. We got some information about the makeup of the group that participated that was surprising in a couple of ways that Jeff will get to. And then we did an assessment of all the existing databases that are available within the community. And we put together some demographics based on that. We also looked at your policy and procedures. And with all of that, we were able to come up with some initial findings. We did a really deep dive using all of those elements, and Jeff will lead us through what we came up with.
Thanks, Donald. Our plan here for the next few minutes is to share some of our findings, talk a little bit about where this work goes from here, and then open it to you all for a few minutes of questions as we have time for. I'll try to move through this as quickly as I can, and also to assure you that you'll have this report in your hands before too long. So everything we're sharing today, we're refining right now and we'll have out to you. This is just the basic racial disproportionality. You can see in each line on the left is the general population of Maricopa County. The middle is the poverty population. We define that as below the federal poverty line. We also often look at deep poverty there, which is 50% of the federal poverty line or below. And then homelessness as measured in HMIS, so in the Homelessness Management Information System. We know that has limitations. We know it's not a perfect picture, but that's what we're showing here. It's sort of the best definitive number we have in terms of racial breakdown. The white proportionality you can see is 54% of general population, about 47% of homeless population. The Hispanic or Latino population is just about a third of general population, similar in poverty, and then there's an underrepresentation in the homelessness population. I can get back to that in a minute. That's not unusual. We see that in communities around the country, and we've got a lot of thoughts on what may be driving that kind of underrepresentation. The Black numbers are through the roof, 25% of the homeless population compared to just over 6% of the general population. Asian Americans are underrepresented in the homeless population, and Native Americans are dramatically overrepresented at a rate of about 2 to 1 compared to the general population. That's the red line down at the bottom. We can talk about this in more depth, but what I take from this is that African Americans and Native Americans are dramatically overrepresented. We see that trend in every single community we work in across the country, and we have for a number of years. So you're not unique in that way. I think you're experiencing a lot of the sort of fallout of historical discrimination that is still driving who becomes homeless. Just to put that into some takeaway points, African Americans are in the homeless population almost 4 to 1 compared to the general population, and Native Americans about 2 to 1. The question about Latino homelessness underrepresentation could be a number of things. It could be an undercount, that people simply aren't coming in for services. It could be that people are misidentified, that the sort of ethnicity box doesn't always get checked or tracked correctly. It could be that people are doubled up, living in overcrowded housing, that there's something else going on with social networks that's keeping Latino people from becoming literally homeless in the same way that others are, at the same rates that others are. But it's an issue that I think needs more exploration, not just in Maricopa County, but across the country. When we asked about public perceptions of homelessness, this was coming both in the focus groups and in the provider survey that Donald mentioned. The drumbeat was that the general public thinks of people experiencing homelessness as lazy, unmotivated, and there by choice. Those phrases kept coming up over and over and over. There's also a perception, and one that I think the quantitative data shore up as well, that racial discrimination in housing and the criminal justice system drive high rates of homelessness for people of color. We also saw this sort of ongoing housing discrimination. One African-American woman in one of the focus groups talked about how she had always wanted to live in Surprise. Her case manager called a landlord, found a place there. It was all going really well over the phone. They get there in person, and she says, when he saw me in person, he said, I'm not going to rent to her. And then she went on to describe this as a sense of racial discrimination. That's what she felt was going on. We heard from a number of the interviews we did, as well as from the people experiencing homelessness who were participants in the focus group, a ton about addictions. And there's a New America report that just came out a couple of weeks ago, where Maricopa County is one of 3 case studies looking at evictions in communities across the United States. And there's an obvious racial connection with that. The Eviction Lab out of Princeton is exploring this a lot these days. One of our interviewees said, landlords can do what they want to folks. And so traditional prejudice and implicit bias creep in, and it's typically about race. They went on to say that the courts don't keep data on racial and ethnic breakdown of who's being evicted. And this is something that we can come back to in the recommendations later. A lot of the strategy sessions we did at the end of August identified that data issue as one to push on from an advocacy point of view. We heard a huge amount about criminal justice involvement, and some that was, I think, louder in Maricopa than what we see in a lot of communities. We always see a connection between criminal justice, racism, and homelessness, but we heard this in such a powerful and kind of repetitive drumbeat kind of way from people who had never had criminal histories, never had trouble with the law, never had trouble with the court system. This one gentleman said, I'm 56 years old. I've never been arrested. I come to Phoenix and I get arrested for standing on a corner. And then he was in the criminal justice system, having trouble paying fines, had IDs taken, had just this cycle at that point, which you all know extremely well. We also heard some about discrimination within the homelessness system. And one participant in the interviews said, it's possible that there's discrimination within the system and the shelters. And they talked about people of color not coming into the shelters, not coming into the intake centers, and asked, what can we do to restore trust in systems that are meant to help people? But when people of color, and we heard this from Native Americans especially, who were part of our interviews and focus groups, they have come to deeply distrust the system. So when a system has mistreated you and your people for decades and generations, what makes you want to trust that system now? And so there's a lot of sort of, I think, internal reflection that needs to happen even within the homelessness system. We saw some really interesting stuff that we don't know what to fully make of, but this is the duration of homelessness by race. And what we saw was that African Americans and Hispanic or Latino people had the highest duration of homelessness, averaging at about 104 days between those two groups. White non-Hispanics, 98 days. Asian Americans were also high. So there are not a lot of Asian Americans within the system, but when they're there, they stay homeless nearly as long as Latino people do. Native Americans had the shortest duration of homelessness, still long, still over 3 months, an average of 92 days. But that's an area that needs more examination too. It's interesting, and it's interesting to see, are there certain things that are driving that shorter period of time for Native Americans that we can maybe learn from? Returns to homelessness looked pretty bad in rapid rehousing, actually. They looked much better in permanent supportive housing. The housing retention rates were better. There's a racial difference, though, in both, with people of color returning to homelessness at higher rates from rapid rehousing. As you can see in the chart there, people who identified as multiracial had the highest rate of return to homelessness. Native Americans and Black or African American folks also high, and then Hispanic folks certainly higher than white non-Hispanics and Asian Americans. We heard a lot about the prioritization system, and this is going to become an area of focus, which we'll talk about in the recommendations as well. But the idea that the VI-SPDAT could be contributing to racial disparities and not solving it, that what was designed as a sort of colorblind tool, I'll say that in air quotes, is actually creating and perpetuating racial disparity. And the way that works is that white folks have a higher average score than Black folks do. White folks get prioritized for permanent supportive housing. Black folks get rapid rehousing or nothing, less intervention than that. And then not only do you have more support for people to be successful in permanent supportive housing going towards a population that is whiter, you also have that higher rate of return to homelessness that we talked about just a minute ago. So that is definitely a priority going forward, to really analyze the whole intake system, starting with the VI-SPDAT, but the whole machinery around how assessment and prioritization happens. As Donald said, we also looked at the race and ethnicity of the homeless services workforce, and we found a pretty diverse workforce, actually. About 53% white non-Hispanic and about 47% people of color, with 13% African American, 16% Latino, 6% American Indian, and 1% Asian, 11% other. That got less diverse as you went up the hierarchy. So we did ask about executive leadership versus direct service staff and some other splits like that. And leadership gets whiter as it goes up. There's actually quite a bit of if I'm remembering right, quite a bit of African American leadership, but very little Latino leadership and very little Native American leadership as you go higher in the ranks of the organizations. We also asked about lived experience with the issues that you all are working on, and found that about 36% of the people who responded to the survey, and as Donald said, I think we had 256 responses. So, it's not a perfect snapshot of your whole workforce, but it's significant enough that we feel confident in how we talk about these numbers. 66% of your workforce have lived in poverty. 42% has personal experiences of mental illness, 36% with substance use recovery, and 23% a range of other issues. domestic violence, trauma, racial discrimination, foster care, immigration issues, police brutality, et cetera. We asked about staff training needs, and I don't want to get into a lot of depth on this except to say that understanding structural racism and implicit bias were far and away the top ranked priorities. People also talked about the need to understand historical and intergenerational trauma among African Americans and Native Americans. What's on this slide is now shaping a training strategy that we're entering into in conversation with MAG, and so you all will certainly be involved in that and kept apprised of it. The important note here is that not everyone is supportive. These quotes come from the survey that we administered, and I'll read a couple of these and let them sink in. We heard comments fundamentally challenging this whole focus on racial equity, including you're making the situation worse by differentiating homeless people of color versus homeless white people. Stop trying to center racial equity. You're creating a bigger divide. Someone else said people need to be true to who they are. No interracial marriages. Each race should look after themselves. Someone else said we need to help people get out of that mindset and stop thinking like victims as they were in the 1900s. Somebody else basically said stop focusing on all of these issues, focus on the individual. When you focus on race, gender, and ethnicity, you're taking away time and energy and resources from fixing homelessness as real issues. Hard to hear, I think not terribly surprising. I would rather know that those attitudes exist and are what we're contending with, and then we can figure out what to do with that. Folks also talked about going upstream, and somebody said, this is a quote from the survey as well, when you really think about preventing and ending homelessness for people of color, look at the systematic elements even before people enter into homelessness. And I know we're moving through a lot of information very quickly. I'm going to turn it back to Donald to talk through the recommendations that came out of 3 strategy sessions we did with the work group and a number of other community members. Many of you were part of that, and you've heard some of this data already. You've contributed to the ideas that Donald's going to share next, and then we'll talk about next steps and then open it up.
Thanks, Jeff. And so we went through a prioritization process with 3 different sessions. And through those sessions, we came up with these 7 priorities for your community. And I know you can see them. I'll just go through them real quickly. Lived experience, coordinated entry, criminalization, housing, discrimination and evictions, data, cross-sector collaboration and prevention, and workforce issues. So,
and Donald, I would just add on these that there's a lot more depth behind these that came out of those groups. And we'll talk about next steps in a minute, but we're working on giving all that detail action behind it so that it becomes a real work plan here over the next several months.
Thanks, Jeff. And so the next steps are for us to finalize the report. We do want to bring in some additional data. For instance, that data on evictions just underscores what we got from both the individual surveys, the group surveys. We also want to continue the regular meetings with the Racial Equity Leadership Group. Again, they have been fantastic in helping guide us through the process. We want to start to do some implementation coaching with the subcommittee structure and regular coaching calls with the team leads. What we're hoping is that in that leadership group, different individuals will take on different priorities and kind of run with them. And we'll do some coaching to make sure that that process is moving along in a strategic way. We want to continue to do ongoing learning through training sessions and other targeted sessions that may result from either the strategy sessions, the coaching, or the individual training sessions. And then we want to work on engaging people with lived experience through virtual town hall sessions. We also want to do some coaching with the Lived Experience Action Board and continue to facilitate discussions as they arise from our conversations with those groups.
So that's all we got for you. We would be happy to take a few questions. If there's time, Tamara, I think we'll kick it back to you and you can let us know how much time you think is available to do that. Here's our contact info. We'll just leave that up for a second before I stop sharing the screen, feel free to reach out to us. We're also copied on the invitation to this session. So if you have any follow-up that you'd like us to attend to, we'd love to hear from you.
Thank you, Jeff. Do we have any questions or comments from board members?
I was just sort of waiting to let others weigh in, but Donald and Jeff, thank you very much. And as a board member, I thank you for the participation from our Race and Equity Committee, and I thank you for that and the recommendations you put forward. I guess at this point, I would like to hear from Steve and Julie too about what's next. We had to go through the process that we went through to get to where we are right now, but I think what we're all really focused on is what's next and what we do about the findings that you found. So maybe hearing about what's coming, what's to come.
Julia, you want to start and then I can comment?
Sure. Thank you, Jeff and Donald, for participating today and presenting the information. I know, we've had some good community feedback and participation, but not everybody was able to participate, so thank you. So yes, initially, we had this first contract that we started with, and unfortunately in the beginning, we did have to kind of delay the process because of COVID. But I was happy with the results, but we did also realize that there was a lot of work to be done. And we did be able to finalize a second contract with Jeff and Donald. So moving forward, we're going to be able to work with them within the next 6 months to kind of work on the implementation of the recommendations.
Yeah, and and to your point, until Dee Dee, you heard from and again, thank you, Jeff and Donald, for wonderful work up to this point and great recommendations and really impactful information already that we're learning from. One of the things we are going to focus on, Dee Dee, moving forward is it's not just training, it's about action and actually influencing the system that's sustainable over time, where all of us could continue to look at our whole continuum with a racial equity involvement and a racial equity lens. So I think moving forward, the next phase will be really engaging with all of that. And as Jeff and Donald reporting on, reactivating the leadership team that was involved in this whole process, to really start looking at impactful steps to influence and improve the system. Again, looking at structures such as coordinated entry, what does that mean? How to look at that with a racial equity lens, and how to involve staff with their work on their clinical work to look at the folks they're honored to serve with racial equity as part of the work that they do. So that's where we're going. It's exciting. And we're looking forward to doing this work with all of you on the call today.
Hey, it's Eric. I'm really, really appreciative. This confirms, I think, or starts to confirm a lot of the understanding that some of us had. I think it's deeply unfortunate, the situation that we're in and we're in across the country. So I just appreciate the work that's been done. I'm also like, let's go. Let's do the work. I'm so pleased that you came with next steps and we're ready to rock. I don't think you need any sort of approval from us today, but I just want to encourage the work going forward. I love the concept of monthly, setting something in place with monthly trainings. I think that's really smart. Let me ask a question. Maybe Julie, you can answer this for me. The lived experience group that was mentioned, is that something we need to create, or is there something that's already in existence? Or whoever can answer, Jeff, whoever.
Yeah, this is, Jeff probably can speak to this a little bit more, maybe even Donald. We will have to create that. So, we will be looking for guidance from Jeff and Donald to help us, and what's the best way to do that.
You guys have heard me. Yeah, go ahead.
Sorry, Eric, go ahead, please.
No, go ahead. Go ahead.
Well, just a couple things. One, just to be really clear that we're standing on the shoulder of folks in your community who have already been at this for a long time. As you know, I mean, every interview we did, everybody said, talk to Nikki Stevens. Nikki Stevens and I have been having this conversation for years. Joan Service and I have been having this conversation for years. You all have leaders in your community, like Dee Dee and like Samantha, who are driving this work already in so many ways. So it's not, we had no illusions that we were coming in and starting something. Our job was to come in and help point it a certain direction. The reason we pause and do an assessment like we did is not that you're necessarily going to learn a lot of new stuff. You probably learn a few new things that sharpen your focus and sharpen your analysis of the issues, but it also gives you something to stand on, to have a kind of formal report in hand that documents this point in time and gives you a kind of launch pad into action. We have just found tactically useful. The other thing I would say is that to Eric's very good point about get on with it. Let's get to action. We heard that a lot in the interviews. We heard it a lot from the work group. And it's always a balance between a bias towards action that is sort of like random and aimless and too fast versus, action that is thoughtfully done and also brings people along up to a common understanding, common baseline before you just start flailing away at something. And I'm also very action-oriented. Donald's very action-oriented. But with racial equity, we feel like you don't get a lot of shots at this. If you don't get it right, a community can be very quick to dismiss it and very quick to say, we tried that, let's get back to normal. Let's get back to how we used to do things. Or let's get on to the next priority. And so it's got to be done well and thoughtfully and with a long view in mind, that what we're trying to solve here is hundreds of years of racism and discrimination that has brought us to where we are now in homelessness. And we're not going to end it in 5 minutes. We're not going to end it in 6 months. We're going to take some very clear action towards ending it. And I think if you all mobilize behind that, you can accomplish amazing things. But this is long-term stuff, trying to unpack where we are and dismantle some of the structures that are still so clearly working against certain racial and ethnic groups. That's a long answer to your question. On the lived experience front, we've just seen that to be a critical component of doing this work well. Like, how can you do work about racism and homelessness without people of color experiencing homelessness at the table? When a community already has that structure in place, we'll often kind of like bring a racial equity initiative alongside that. When it's not in place, we work with folks to put it in place like we will with you all.
Great.
I will just add that in the focus groups that we did, we probably identified a number of people who would be really great in the work, and we'll share that information with you as well. And I'm sure you have people in mind that have worked at different levels of maybe board work or people that are in the particular programs that might be helpful in that as well.
This is Bruce. Thank you so much, Jeff and Donald. This is very helpful to me and really important work. And I agree with Eric in terms of getting on with it. Since homelessness, there's so many drivers of homelessness. You mentioned criminal justice, housing discrimination, mental health issues that aren't being addressed in the community. So there's things that I already hear and thinking about that we can put into place that are going to be really important structures to have. Is it reasonable to try and think about how do we measure progress? I mean, there's going to be an impact on the individual level, and agency and all that, that'll be really good. But can you change the numbers? Can you change the disparities without addressing this structural policies of who gets put in jail and who can get housing? Has any community done that kind of said, hey, we can see a measurable difference?
Has any community done it? I mean, if there was a great example, we would just be holding them up and saying, do what they're doing. Well, I think what we're beginning to see is people just beginning to take action. And so, we're seeing places that really have revamped their coordinated entry system on a theory of change that if you do something different there, you can achieve better housing stability for different groups who weren't served well by the current system. We have seen a couple of communities really begin to drive down the numbers around particular groups where, data showed in one community 25% of the overall homeless population were Black children under 18. And they began to focus programming and energy and resources on that group and have been able to drive down that number and the disproportionality. We're always in a resource scarce environment where when you decide to focus on one thing, it is often at the expense of something else. And so, that's a tricky thing. I think, Bruce, to your question of can you measure it? Absolutely. I mean, you can measure sheer numbers in terms of reduction of homelessness for people of color. You can break that down by age and gender and household type, singles, youth, families, et cetera. And you can do it by looking at disproportionality over time, obviously we all want to end homelessness for everyone, right? I mean, we're on that same commitment with one another. Until then, can an incremental step be bring down the disproportionality of Black folks and Native folks to a place where it's at least on par with the general population? I mean, on the way towards ending homelessness for everybody. And that does take real courage. It takes a real commitment of resources, but that's the kind of number you'd be looking at to measure, I think. The Racial Equity Action Plan that we're kind of developing now and we'll be finalizing with the work group will have those kinds of targets built into it.
Thank you.
And I think just to add really quickly, there's a couple of different levels, and we talk about this in our training. We talk about spheres of influence to dramatically decrease the disparities. It is a wider picture issue to address some of the underlying issues. But I think the first goal is always to look at what you can change within the system. The MAG system. What are the immediate things that you can do to kind of move the envelope a little bit? And I think there's a number of things that you can do. And I do think that what we'll be able to do is kind of identify those things and guide you in that direction.
And this is Tad too, and I also wanted to really thank you guys for all this work and also the subcommittee too doing this. It's really critical work, and I think we all agree how critical this is. I'm just wondering, in your comment about the span of control, that we have, I do think, will your report also at least acknowledge those other pieces that might be a little bit outside of what we're able to control, but at least bring awareness to what might need to occur, and some of us may be able to go outside of that span of control for this committee to really influence some of that even larger work that really needs to happen. But I'd be remiss in not, saying we probably do need to have some level of sight within the work that you guys are doing on some of these things that may be impacting, that might be a bit broader than what we might be able to control.
Yeah, Tad, this is the conversation we were having with the work group last week when we talked about this, was basically those 7 priorities, which Joan asked if we could post in the chat. It's huge, right? I mean, how do you fix all that, and where do you start? And you can't do it all in 6 months, between now and March. So you start with the things that you really have the most influence over, the spheres of influence that you can really control, right? That's sort of the starting point. You try to get some traction and make some progress and get some momentum. There are some things that are kind of a given. We're going to do training. If we move towards building a lived experience group, those things kind of permeate all of it. So, can we pick off a couple of those other ones to begin with? And then the ones that are beyond our sphere, the upstream stuff where we're really trying to turn the faucet off, or the long-term housing development and eviction stuff and all of that, can you take some steps towards building the groundwork, building the relationships, strengthening the collaborations over the next 6 months to a year, while you're really changing this stuff that you can control, but you're beginning to build the bridge towards those other things. So you don't want them to drop off the radar screen totally and only choose 3 priorities, but you do want to choose 3 things to start with, right? In a kind of traditional strategic planning kind of way, but then take some steps towards these other bigger picture, really more permanent solution-oriented kinds of things.
Yeah, that's great. Thank you.
Great. Thank you so much, everybody. I'm so sorry, Eric. We have to move on because we have such a full agenda, but maybe you can just chat.
Yeah, I'll do it.
Perfect. All right, we're going to move on to the next agenda item. And thank you so much, Jeff and Donald, for joining us today. That was really illuminating. And I mean, I've already seen it, but thank you so much for presenting it to the larger continuum. Next on the agenda, we have the Nofa update, and that is Julie from the Maricopa Regional COC will provide a brief update on the status of the 2020 Nofa. Julie?
Thank you so much. So our most recent update that we received last week from HUD is that they're still working on a non-competitive process for this year's Nofa. An announcement has not been made yet, but they do need a congressional approval to be able to do a non-competitive process. So we'll keep you all posted on that. Last week, we also informed our renewal programs that we were extending the deadline one final time to this Friday, October 2nd, for them to complete the Presto questions and materials. And again, we'll just be keeping you all posted as we hear more information from HUD.
Thank you so much, Julie. Rob, are you still on?
Yep, I'm here. Can you hear me?
Yes.
Perfect.
Next agenda item?
Yeah, absolutely. So sorry I'm joining by phone. I'm out in Denver on a suicide intervention training. So I can't see the chat. So if there is anything, if you can let me know, Tamara. But we're going to move on to item 6. It's the VA HMIS plan. And joining us now is Melody Boyette and Jeff Wilgell are going to discuss and present on the VA HMIS plan.
Hi, how are y'all doing? I'm going to go ahead
Great.
and I'm sorry?
I said we're doing great.
Oh, okay. I'm sorry. We're having a bit of difficulties today. I believe Steve's now logging in to show our flow chart for our purposes. Oh, perfect. Okay. So my name is Melody Boyer. I'm the section chief of the homeless programs at the Phoenix VA. I have with me
Jeff Wilgell, Healthcare for Homeless Veterans Coordinator with Phoenix VA.
So Jeff and Penny are my go-tos in terms of this project. So our organization decided to move forward and a move away from HMIS, primarily because what we saw on our end was duplication of efforts. And by that I mean is we have an internal database that we use in the homeless program called Homes. This is the same information that we use to record everything into HMIS. So as you can imagine, that ended up being a little bit of an administrative issue for us and eating up some time that we wanted to make certain that more time was being dedicated to clinical opportunities with our veterans. So that's the start of this project. So we started this change idea to move away from HMIS, but also to have the VA to take the lead on the by name list. And we reached out to our fellow access points and asked them about this, and sound like we had a great simpatico and they were supportive in this. And so we went with that change idea. And in the nexus of all of this, my team, as well as this work group that we were able to form, we started reaching out to other communities to see how do they manage their by name list, what works, what doesn't work. And we were able to come up with a product that we can show everyone. And I'm going to see if I can find this for you. But that said, what it looks like is one tab will have the VA data. We'll be able to record everybody that's homeless on our end. The other tab will contain all of the data that we still gain from the HMIS data system. And that said, what we currently have is a report that we get every Monday. We would still continue to get that report from the community every Monday so we could continue our practice of having case conferencing meetings every Tuesday. Now, what Steve is holding up for all of you is our current process. You go to the left-hand side of the panel. Just to give some kind of context, each veteran that we intersect with that comes to the front doors here at the CRRC, we spend approximately 2 hours with them. So everything you see on the left-hand side is what we're currently doing. So again, this is a full assessment. And when it says homeless program assessment, it sounds somewhat general, but this really is like our universal screening so that we can look and see what programs veterans are meet criteria for, and that's exhaustive of every program we have available in this area. And then in addition to that, the homes assessment. And for us, the most critical piece is that suicide risk assessment. I think, so most of you understand this is the background that I come from. I came from the suicide prevention program. So this part is something that we've seen an uptick in the time of COVID with suicidality and suicide risk. So this for us is critical to make certain that every veteran out there we're having that assessment, we're asking those questions, because at the end of the day, our job here in the VA is healthcare, but also, again, to make certain that we're keeping our veterans safe. On top of that, we do clinical reminders, which assess multiple issues. That could be employment, that could be mental health, that could be substance use connections. And then beyond that, we see where we would do HMIS, release of information, so we can share that information with our community partners. And then SNAP is our strengths, needs, abilities, and preferences. So that's just for starters. So as you can see, that eats up quite a lot of time for us, in addition to the administrative piece. So this change idea was born from that, so that we could work smarter and not harder. So that said, that we could simplify and streamline some of these things for the veterans, so that they too are not spending a great deal of their time, that we're able to get them assessed and housed. So that said, we got into this project where we streamlined the data set. In the midst of all of this, I was able to hire a program analyst who is able to be our point of contact for all of this. He's going to merge the list, and he'll be the steward of this information. Somebody that comes with high honors, and honestly, I've been so thrilled that he's been here. His name's Brett Marquardt, so he'll be the point of contact for our end. So the other piece of this that people are concerned, what happens because of the VI spit out. So in reviewing this project, we looked at what's available to us, and for our VA national directive, we can use what's called the case management matrix, and that can be used in lieu of the VI spit out. And it's something that truthfully, we wanted to give a good look at, given that, as you guys heard from the wonderful presentation we just heard, there are some concerns around the VI spit out as it pertains to racial equity and disproportionality. So again, we wanted to use something and try something in lieu of that to see if that, also has some good change and adaptation for that need. But also to present this in context, 80% of the data, give or take, each month is coming from the VA. So we felt like that made sense for us. You know what, why don't we try and take the lead with the list, and then we would be able to get the remaining 20% from our community partners. We're able to do so. We went ahead and met with our privacy officers so that we could meet out any of those challenges that come with that. We have nationally what we call the routine use 30, where we're able to share housing data for that purpose. We're able to share the data on behalf of veterans simply for the purpose of just getting them housed. Now, of course, there are other exceptions. So if we wanted to talk about any, specific private health information, that of course would be discussed with the veteran, and they'd have the ability to sign a release of information should they choose to share that information. So that's kind of how we came to the project. Now, what does the list look like? We have our home system where we can run our report every Monday. It's called our HCHV Case Management Report. We will run that every Monday. That will be our half. The other half will come from CRN, which will still get the HMIS report every Monday. And we'll get that merged together and reconciled to be ready for our Tuesday meetings that will continue for case conferencing. VA continues as case conferencing, and then updates to anything that needed to be updated in HMIS would be done in the moment by our community partners. And again, just wanted to reiterate that when we collaborated with our partners, we had a work group that we met with each Friday where we got most of this information, and we're able to, and Steve, I can send you that sample list. It's a blank copy of the by name list so you guys can see what categories are pertinent. Let me do that right very now. Are there any questions thus far before we move on to the referral piece?
This is Joan from the Housing Coalition. I'd like to continue hearing more, but I do have some questions and some comments, but I'll wait till the end.
Okay, sure. Sorry, my computer is going rather slow. While I'm doing that, I'm going to have Jeff talk about the referrals to SSVF and permanent housing.
Hi, everybody. So when a veteran presents here to the CRRC and we determine the most appropriate permanent housing plan, whether we would be most likely, oftentimes it's going to be SSVF with the VASH component for Section 8 if that veteran meets the criteria for in the case management matrix. And what we're implementing is we'll make the referral in the moment to SSVF. We'll contact the provider. We got the SSVF providers all agreed that they can provide us 3 points of contact, so we'll provide a warm telephone handoff. And at the end of the day, we will also follow up with an encrypted email, and we'll be able to track this in case conferencing on a weekly basis. If that veteran is a veteran that needs a Section 8 case management voucher, that veteran will go into SSVF and will be progressively engaged into VASH as they move into housing, and once the housing is established, and then the VASH case manager will then take over. Again, those will be referrals that will be made in the moment. They'll be made updated to the list every week, and also in addition in case conferencing when we discuss specific veterans' needs. So that's the referral part of it.
And so going forward for this particular team, we'll have the same individuals. For the clinical piece, I'd have Jeff Wilgale, Penny Miller, Michelle Sullivan would all be my points of contact for the clinical side. For the data side, we would have Brett Markhart, who's my program analyst. So we'll have that contained and consolidated. So that way it's a bit easier going forward. And then of course, like I said, I'm always available for questions around this because I realize that this is a massive change to this community. But, you know, in doing this, like I said, we reached out to sister facilities at the VA that are, and I say sister facilities because we're nationally, we're a 1B facility, which means we're a moderate level of complexity and level of care services that we provide. So I reached out to other VAs that have this by name list and asked them, how are you guys doing it? How is it manageable? What sorts of things are you running into? For instance, I reached out to Las Vegas. That was one that they had a very similar makeup, and they had some of the same challenges with their populations that we see in the Southwestern corridor. So again, we use best practices from our other sister VAs in conceptualizing this. And with that, I will leave it to questions.
I just also wanted to add that the VA is still going to be having read-only access to HMIS, and we have found that is going to be helpful when we do targeted outreach towards specific veterans in specific geographic areas of our community.
Thanks, Jeff. Thanks, Melody. Joan, you had mentioned you had a question, comment. You want to lead off?
Sure. Yeah. And again, I'm going to admit that I may not be the most versed in all the acronyms and what have you, but I just know that there was a lot of effort our community made in collaborating and really trying to envelop the VA and really address veterans experiencing homelessness. And it seems like we're taking some steps back. I have some concerns, but I'm going to play dumb and say like, hey, walk me through this, because I know that, I definitely appreciate that we don't want to duplicate efforts. But the home system, my understanding is that the home systems, there was a translator, kind of like a portal to the HMIS system so that it wasn't as administratively burdensome. You said, other states have made similar decisions. I don't know if I would call it best practices, or just I would call it basically that you're copying what they're doing, because I don't know if it's a best practice yet. I have some concerns around this. If 80% of the data is coming from the VA and 20% from the community partners, where's that back and forth collaboration to, again, serve the veteran in need? So I'm going to pause and see if you guys have any feedback for me, because again, I'm struggling with this just to best understand.
Well, and just to clarify that, this community loses nothing. If anything, it's a process improvement. So, you know, to your point about the experience, what I end up finding is my staff finds that the homes database ends up being a bit more user-friendly than HMIS. And that's just from the staff that I've had here. For clarification, this is the 4th city I've worked in the homeless program with the VA. So that's been a consistent experience throughout my career, but I've also seen that consistent here. But I say all that to say is that we'd still be able to mirror the same data. What's needed for this by name list, that is all still going to be available. That doesn't change. The referral process is not terribly different. So in terms of best practices, is something that we evaluate nationally through the VA, and you know, that's something that we do mirror and model from our sister facilities, absolutely. But also taking into account the unique needs of each city in each local facility. So again, nothing changes in that regard. What we're saying is it's a process improvement because we too see some challenges and some data issues that we were encountering, and we feel like, you know, it needs to be addressed in a more streamlined way. To your other piece, the veterans are not going to have any additional barriers behind this. If anything, our intent is to simplify that so they run into less barriers. And that could be a lengthier conversation. So.
Sure. No, and I greatly appreciate, and I know many of the providers on this call can attest to the fact that how often one individual entering into our system has to share the same information repetitively. So I definitely appreciate that you're trying to streamline this process. We're all about efficiency here. I guess my concern lies not on the VA side, but on the community side, because again, the VA is not in a bubble. You know, community providers have to walk alongside the veteran because the veteran doesn't just engage with the VA. So how can we make sure that there's good communication exchange back and forth? Again, the VA has, as you shared, 80% of the information, but the 20% of the information from the community partners also can attest and make different housing choices, housing decisions, intervention decisions for that veteran. And so I just want to make sure that there's good communication. I'm using my hands a lot because I can see myself in the video, but I just want to make sure that there's good communication going back and forth. And I'm worried that this creates not that. So that's what I'm struggling with.
Sure, and we have a couple of ways to accommodate that. I mean, I think anyone in this room can probably attest to how many meetings all of us have been attending, and in COVID, we have just as many with this change idea. If it's any solace, I mean, we have, you know, for instance, a group that we meet with our providers, our SSVS providers, every Thursday, and that's, you know, again, that's a simpatico. That's where a lot of this communication occurs. Those in the moment changes, same thing. That's standing meeting with case conferencing. So again, we can address these things as needed. You know, we have so many processes in play, and I honestly feel like with our providers, you know, we definitely feel like we've gotten a pretty good response from them when, you know, issues or challenges come up. So we've been able to work through those in the moment. I know specifically, you know, Vash, I've spent a little more time with as of late, and same thing, I've been able to see challenges and by the end of, you know, the business day that things are resolved, or at least a plan is in motion. So I feel, you know, from the VA's perspective, we've gotten really good communication from our providers. You know, and there's certainly, you know, any number of ways that we can expand upon that, you know, more welcome suggestions.
Thank you. I think, yeah, thank you. I appreciate that. Well, I guess time will tell, and I appreciate your clarification.
Sure thing.
Thanks, Joan. Any other board members, comments, questions? Okay. Just parting for me, I echo Joan's concerns, and hopefully everything can be addressed. And we just obviously just want to make sure that we're not creating missed opportunities for engagement. And so hopefully all these things can be addressed. And if perception is not reality, then let's make sure that we're communicating. Just as all of you have said, communication is the key. So I really appreciate the presentation. And if there's no more questions, we're going to move on to Tamara with item 7.
Thank you so much, Rob. Next on the agenda is the shelter availability portal for the city of Phoenix. And we're going to hear from Ty Rosenstiel from CRN. He'll provide a brief update on the current status of CRN's proposed contract with the city of Phoenix for that shelter availability tool. Ty?
Thank you, Tamara. I want to thank the Continuum of Care Board and my colleagues for all of their feedback around the shelter availability portal contract with the city of Phoenix. In the many conversations that I had, it was really apparent that this idea of making information about shelter policies and capacity more transparent and easily available is something that's really needed and really desired. But the city of Phoenix has shared that they're not okay with the phased approach that we discussed at our last meeting, because that is not what the city council approved for that particular contract. So as such, I've advised our leadership at CRN that we should not move forward with the contract because the particular project design as outlined with the city of Phoenix really doesn't align with what the board outlined as expectations at our last meeting. So with that, CRN, we fully intend to move forward with this tool because of the benefits that it would have. But in continuing this project, it's going to be a different project design and a different implementation strategy that really aligns with what the board had described and with the community feedback that we had described previously. So that's the update that I have. Does anybody have any questions for me?
I have a question from the public. Is that okay to ask a question?
Yes, please, Darlene, go ahead.
Okay, yeah, Ty, I know that you've met with our staff, and I'm very thankful that you've met with our staff and took our concerns under consideration. And as you move forward, we would really like to work with you on that. We consider you guys a great partner of ours. And one of my concerns really had to do with diversion. You know, diversion is one of those areas in the Family Housing Hub that were measured through the HUD contract. And we have a great diversionary rate. And I wasn't sure how that was going to be addressed in the contract that was with the city of Phoenix. But now that we've moved away from that and you're going to be implementing a different type of project, we can talk about that at a later date. And I won't take the time of this meeting to discuss that further. But thank you, Ty, for your partnership, and look forward to working with you and the COC board. Thank you.
Thank you, Darlene. Any other questions or comments from the board?
I just have a general kudos to you, Ty, you know, from the COC perspective. Thank you for being transparent throughout this process and taking the feedback I know was challenging at times for you when this was all formulated. So from the COC, we're very appreciative of you being able to do that. Thank you so much.
And I would also add that you know, that same kudos should be, you know, extended to the city of Phoenix as well. They were very transparent in conversation with me of what they could and couldn't do, outlining what they were able to fund. And the feedback that I got from the city was not that they didn't like the project as described by the board, but just under the limitations of the funding and the structure and the approval that had already taken place by city council, that they couldn't move forward under that particular design. So, you know, I would just want to extend that same gratitude to the city as well.
Thank you so much. And I think Rob has jumped off to go back to his training. So we will move on to item number 8. COC work group update from Sarah Kent.
Good afternoon, members of the COC board. I am Sarah Kent, as Tamara said, and I facilitate the Maricopa Regional Continuum of Care work groups around ending homelessness. The COC work groups continue to be a repository for conversation and information exchange to find solutions around ending homelessness within the whole region. Initially, in all the work groups, for example, the Ending Youth Homelessness Work Group or Ending Veteran Homelessness Work Group, the Outreach Collaborative, the Ending Family Homelessness Work Group, and the Ending Chronic Homelessness Work Group, the COC has been pushing out HUD and CDC guidance in regards to COVID-19 and continue to share new guidance as it comes out. Aside from COVID-19, updates and providers are developing shared best practices. Work groups are doing HMIS data dives while looking at community solutions, Vote for Zero dashboard for each subpopulation. The awesome folks of HMIS or CRN also provide the work groups with data on COVID-19 assessments that providers are encouraged to utilize with their clients. In all the work groups, as of recently, we've discussed HUD strategies for eviction prevention, HUD's new tools for landlords with tenants impacted by COVID-19, and HUD's tenant guidance and rental repayment plans. We've also invited and continuously updated work groups on the racial equity work that the Continuum of Care is doing through the awesome folks who just presented, Racial Equity Partners. Work groups have been made aware of the City of Phoenix Strategies 10 Homeless Plan, as we talked about earlier, so that they could give direct feedback to the City of Phoenix if they choose. Internal Revenue Service has also been attending work group meetings as well to make providers aware of the October 15th deadline to register for the economic impact payments and the virtual training they will be hosting for providers on October 8th to help answer any last minute questions. The AZ Housing Coalition regularly provides a legislative update for the work groups. Lastly, each of the work groups are working on change ideas that focus on obtainable goals such as inflow improvement ideas and housing placement and target change ideas. We're also keeping our Continuum of Care partners informed on new HUD guidance and proposed modification policies that affect folks experiencing homelessness. For example, HUD's proposed modification to the 2016 portion of the Equal Access Rule that rolls back provisions added during the previous administration that added a section to the Equal Access Rule that requires all HUD-funded housing services to be provided without discrimination based on sexual orientation or gender identity. Specifically in the Outreach Collaborative, we've been looking at the Outreach Viewer and new advancements that MAG's Regional Analytics Division has recently made. Directly from the recommendations of the Outreach Collaborative. In the Ending Youth Homelessness Work Group, we're working to break down the barriers with the Family Unification Program vouchers so that youth can access these vouchers in a quicker, more efficient manner. And then as usual, we give the agencies the opportunity to give updates and ask questions to each other for deeper collaboration with other partners in the meeting. And that's my update on Maricopa Regional Continuum of Care work groups around ending homelessness. And I appreciate everybody's time. And with that, if anybody has any questions.
Thank you, Sarah. Any questions or comments? Okay, hearing none, we'll move on to item 9 for COC board recruitment, and Steve will provide an update on the board recruitment process.
Yeah, hi everyone. Just a brief summary. We are proceeding ahead with the board recruitment process. You all received, the initial invite and email and the protocols that were to follow. I put out a request for resumes for interest, and at this point we received 4 back. Upon receiving those resumes, I sent out a survey monkey where they could fill out an application asking questions that you all saw as well. I haven't received any of those back, but they are due October 16th. And after that, our wonderful board volunteer subcommittee for recruitment will vet the applicants to be presented at the October board meeting. I just want to make everyone aware that right now, even with the 3 departures from the board, if it is seen that recruitment or the people that have applied aren't feasible for a board seat, we still have enough quorum to move forward, given the Hearth HUD Act standards, that the board has enough people on it to move forward. So we don't, we would like new members, but we don't have to invite new members on if the board so chooses. So we'll see how this plays out. We are moving forward, and that's the summary right now. If you have any questions or questions for me now, great. If not, you could always email me and I'll update you more. Thank you.
Thank you, Steve. Would you mind just reminding me how many seats are open again? Did you say that? I just missed it.
There will be 3 seats open. It would be a seat for, well, actually 2 seats for either a policy advocacy or a funder. And there's also 1 seat being vacated that would be for a community, funded provider, since Dee Dee's time on the board at Great Service has to leave us. So that's where we're at. We'd be looking at 3 seats.
All right, thank you so much. Any other questions for Steve?
Tamara, this is Dee Dee. If I could just make a comment. So I can't even remember where when I came on the board, but I would just like to say, I know that Jackie and Charles will do a good job representing the provider community, but losing Amy's voice and Darlene's voice and then my voice, I think we've been really strong providers in the community that really reflected back, how some of the policy and decisions that are being made actually affect us as providers in the community. And with all good intentions, even in my own organization, when I make a policy decision or change something, I'm really trying to reflect back to the people and involve the people's voice that it may affect, because I don't even know sometimes the unintended consequences of things. And so I know there's been, I've been on the board so long that sometimes the provider's voice has been highly respected and almost like lived experience and treated that way. And sometimes it hasn't very well. It's been seen as self-serving and those kind of things. And so I really hope we've moved past that time and that we're really considered, the provider voice is considered like lived experience voice, that it's invaluable to really feedback when changes are made, how it's going to really impact us every day when we operate our programs. So I'm hoping that we do get another strong provider to support both Jackie and Charles's voice. So just thank you for the opportunity for letting me serve all these years. And yeah, I'll probably sign on and ask when I can talk sometime, like Darlene did.
I hope
I think we all expect that, Dee Dee. I will say this, with the board recruitment, as you know, every year it's an open invite, so we can't, it wasn't like we identified specific individuals, but certainly in your line of work, you might hear people ask about what's going on with the board, and if there's interest by anyone you hear, feel free to have them email their credentials to me, and we'll put them on the list for consideration. Thank you.
Thank you. And we, as a board, I know when I participated in the recruitment last time, I believe our priority is still making sure that we try to achieve diversity. And so people that are diverse in nature are really highly encouraged to apply.
Absolutely. Right. Thanks.
Thank you. We'll move on to item 10, which is a presentation from Amy Schwabenlander from HSC. She will discuss the request for shelter beds. Amy?
Thank you. And I don't know if I can share my slides.
I could do it, Amy. Let me try, okay? Hold on one sec.
Thank you. I'll just start talking because I think you all wanted to be done in maybe 10 minutes.
Okay, let me see if I could get it.
No one's nodding yes or no. So, something's happening. Okay. So thank you for adding me to the agenda. They're in the last hour before finalizing your agenda. I appreciate it. In conversation with a couple of board members and Stephen, I thought it was important, the members here on our Human Services campus thought it was important to raise this formally with you as the Continuum of Care Board to share information so that you know what is going on from a shelter perspective and our request that is pending with the City of Phoenix. to add shelter beds. I do have a slide deck. A lot of the content that will be familiar to all of you because it references some of the need around the campus. You can, yeah, just, okay.
I'm trying to, give me a
Thank
second.
you.
I'm not good at this stuff. Hold
No,
on one second.
You can hit
it's
F5,
okay.
Steve. You can
Right
hit
here?
F5. F5.
F5.
I love the
It didn't work.
technical
Oh, there we
support
go.
on your call. Thank you. You can go to the next slide. For those who are not familiar with the Human Services campus, we're located near 12th Avenue in Madison, just a block south of Jefferson. So the bright blue building towards the center of the photograph is the St. Vincent de Paul dining room. And we have 13 acres of property that heads to the left or west of the blue building until you run into the cemetery. And then the northern kind of vertical line on Madison Avenue. In our special permit request, we also have the addition of Andre House. So the property owners in our application to the city are the HSC Inc., St. Vincent de Paul, and Andre House. Next slide. So currently we have a special permit to be able to have shelter and dining. We are in an industrial zoned area, although we were under the Capitol Mall overlay, and that Capitol Mall overlay is what requires the special permit for temporary shelter beds and charitable dining. The current two stipulations on our special permit are the maximum number of shelter beds, which was set at 425 back in 2005, and the actual site plan. And as many of you know, Maricopa County owned the campus when it opened in 2005. Next slide. And this chart should look familiar to you. I'm sure you've all studied it and have the numbers memorized. When we look at the other dynamics in our community, we also have rapid population growth that's been over the same time frame. Phoenix's population continues to grow. Housing is underproduced in comparison to population change. Income is not keeping up with increased cost of living. We have an affordable housing gap. And in this time frame, the county deeded the property to the HSC in October of 2017, transferring that formal ownership from the county to our nonprofit. Next slide. You should all be familiar with this map as well. We're hearing a lot of comments as we've been in community conversations, neighborhood associations over the last year and a half since we filed our amendment, where a lot of folks, I would say in the general public, do not recognize how much of a regional issue homelessness is. And so we share this unsheltered map because people do believe that the 200-ish people who are right here unsheltered around us at the Human Services campus are the only unsheltered people. Next slide. What's changed here at the campus, number-wise, that we also spent a lot of time talking about, is that shortly after the campus opened in 2005, the county allowed CAS to have men sleep in a building on the north side of Madison, which is a warehouse building. 250 people slept in there, known as the MLS, or the Men's Overflow Shelter. And then over time, another 250 people were allowed to sleep in the parking lot. And so what you see from the left to the right are the years and the changes in outcomes from the campus related to permanent housing exits, the number of clients that entered the campus when were assessed for coordinated entry, the total number of client interactions we had, and then the number of shelter beds. So when the MLS was open, those years, 2015, 16, 17, and 18, there were 720 shelter beds if we counted CAS and the MLS, not including people in the parking lot, because none of us believe that sleeping on a mat in the parking lot is a shelter bed. And then in 2019, when the overflow had all closed, the movement of overflow into St. Vincent de Paul and LDRC had phased out, we were back to 470 beds in CAS. Next slide. Our request then officially to the City of Phoenix is to amend our special permit. And I wanted to share this because I know there's a lot of conversations about what are the numbers, what are they really asking to do, what is this going to look like every night. Our amendment would allow us, bottom line, to have a maximum of 1,000 people sheltered here in all of our spaces. The way it would break down is allowing CAS to go up to its certificate of occupancy maximum, which is 700. And for Andre House, in in an empty building that they own to go up to 100. That would mean a total nightly capacity of 800 people in shelter, 365 nights per year. The other 200 beds would allow us to provide weather relief shelter in St. Vincent de Paul's dining room or our Lodestar Day Resource Center day room when there's extreme heat, when there's freeze warnings, when there's rain. So we would not have 1,000 people a night. We are not adding buildings. We are not adding 1,000 people onto the top of the shelter that we already have. Hopefully this demonstrates the math in a little more clear way. Next slide. A lot of what we've spent time over the last year and a half doing is talking with the neighbors, hearing their concerns, working with them on possible solutions. Some are, of course, short-term, some are long-term. You see the list of things on the left-hand side, and you see things on the right-hand side that we've done or we've been doing. The Clean Zone is the name of a program that we've created with Andre House. It's now in its second year of operation, where client volunteers pick up trash around the campus on Mondays and Fridays. The City of Phoenix does a street cleaning on Wednesdays and picks up trash in the surrounding area. And when we also speak about regionalism, we point out that we have 20 other access points for single adults in the coordinated entry system. And in FY19, 4,000 people went to those access points and never came to the Human Services campus. So we truly are, all of us on this call, are providing regional services. Next slide. The draft stipulations that we are finalizing with the city are now 5 pages and approximately 20 stipulations from the current 2 stipulations. It includes things like working with the city on abandoning public rights of way, adding trash receptacles on our property, doing more maintenance, which is really trash pickup within 25 feet of all of our property lines and beyond, working formally on approval of safety plans with the police, Department of Public Safety, doing regular community outreach meetings, and reporting annually to the Planning and Development Department. So clearly those aren't all 20 stipulations. It gives you a sense, though, of what we're being asked to do and the things that we have said we are willing to do. Next slide. So I also share this in case you're asking yourselves, well, how can we support the Human Services Campus adding shelter beds? You can send a letter to Mayor and Council. You can share this with your networks. You could challenge yourselves, to lead a regional plan to address the homeless services system valley-wide that includes shelter strategies for all populations. The more we get questions about how many shelter beds are there, where are they always full, it's hard as one provider to be able to answer that question. So really ask everyone to consider how we can all work on that together. The next step is that we just got scheduled with Central City Village Planning Committee on October 12th, where that Village Planning Committee will make their formal recommendation that will then move on to the Planning Commission and from Planning Commission to City Council. Next slide. We also have a separate website from street2home.org. That is a campaign website where, again, people can find more information. You can see the same charts, the numbers I just showed you in the slide deck. There's 3 different ways to get involved. So again, I'm not sure if the COC board can take a formal action or not. If not, or if you choose not to, any individual or your organization are welcome to support us in our efforts to shelter more of the unsheltered. Any questions if there's time?
Thank you, Amy. Any questions from board members?
Amy, this is Samantha Jackson. I think, did you say the Central City Village Planning on October 12th?
Yes.
Are you guys, do you guys have the council dates yet or no?
Well, our signs just got updated with the next 2 dates. That would be best case scenario if nothing gets pushed. So I went out and looked at the sign. So don't quote me on this. I believe the Planning Commission was November 5th and City Council is December 12th. If everything stays true to form.
Thank you.
Thank you.
Any other questions or comments? All right, thank you so much, Amy.
Thank you.
All right, I told you this was a big agenda, guys. Next, we have our legislative update from Joan. Joan?
Hey, I'll try and be real quick. Just at the state level, we're just everything. Actually, this will be real quick because everything's on a holding pattern. We've got about 40 days until the election, and that's going to dictate, where we are with our state legislative makeup and what we need to be doing at the federal level. So October 5th is the deadline to register to vote. I just got to say that. The Housing Coalition will most likely be continuing our legislative agenda items of restoring the State Housing Trust Fund and working to enact a state low-income housing tax credit, which we had serious momentum this last session. And then we are looking at a statewide commission around housing and homelessness. That's at the state level. At federal level, again, there's just a lot of hurry up and wait. We are hearing that there's renewed negotiations, renewed talks between Speaker Pelosi and Treasury Secretary Steve Mnuchin on a COVID-19 response. They've got the House Dems need to trim up at $1 trillion off of their package, but that'll help dictate what kind of housing support this next COVID-19 relief package has. And then the House passed their continuing resolution because, TikTok, it's almost September 30th for the federal government. The Senate is supposed to approve what the House just did in terms of a continuing resolution to continue the federal government through December 11th. And then we'll have a lame duck session to take up stuff like tax reform. As Sarah reported, the Housing Coalition submitted some comments on the equal access proposed rule action. There's also some new action around Community Reinvestment Act. One of the federal regulators also is going to ask for some public comment, but the Housing Coalition needs to do a little bit more analysis as to what that means. So TBD on that. And with that, I'll answer any questions y'all have.
All right, any questions or comments from the board? All right, we'll move on to item 12, request for future agenda items. Do any board members have any action or discussion items for the October agenda?
Hey, it's Eric. I don't have an item, and I presume Steve will talk to us about rescheduling our strategic planning. That was my biggest interest.
Yeah, to answer your question, Eric, we had thought that it would make a lot of sense for the newly seated board members, if any, would be involved in that process. So we all move forward. So that will occur regardless of new board members or not before the November board meeting.
Great, thanks.
Okay, thank you.
Makes good sense.
All right, are there any board members that have any announcements or events that they would like to highlight?
So Tamara, this is Dee Dee. I've been saying this at our board meetings, but we actually have 3 projects that will open up before the end of the year. We have a 55-bed wellness center, recovery center that's going to be opening up. And then on the same campus is Dunlap Point, which is 54 units of permanent supportive housing. And hopefully that'll open up in December. Stepping Stone, I think we're probably taking applications starting tomorrow. We've got a phased certificate of occupancy so that we can get a few residents in September, and then gangbusters leasing up the other 42 units in October. So another PSH project opening up. That'll give Stepping Stone over 125 units on the same campus, and we're really excited about that site. And then I just wanted to make a comment that, as we talk about so many things, language becomes really important. And I just wanted to give my viewpoint on eviction prevention work that's going on right now. And I'm going to turn my video on here just to say that we're not only are we the homeless service provider of probably 400 or 500 units of housing, we're also the owner operator. We're the property manager and the owner of those units. And we've been changing our language from eviction prevention to robust rental assistance. So the eviction really kicks the can down the road. When it really is going to be a crisis in January if we haven't come back and backstopped all those unpaid rents with rental assistance. And so we really need to be focusing our efforts on, robust rental assistance, making the process easier, getting the money out to the community, letting tenants or the landlords apply for the funds for multiple months, and get rid of the layers of paperwork and the who's doing what, and really get people caught up on their rents. And so that's just my 2 cents about language does matter and moving from eviction moratorium to robust rental assistance. So in January, we have people paid up and we're not facing the eviction crisis that we all know we're going to face if we don't do that. So just my 2 cents.
Thank you so much, Dee Dee. That's very important. I completely agree. I've been thinking about that myself a lot lately. Like, what is this system designed to do? What is our customer experiencing? And are we really operating in a way that's very consumer centered, and making sure that they understand what we're saying and they understand where their resources are, and it's not just this like nebulous planning structures or what have you around this, and making sure that they're really aware. I think that's really important. Thank you.
I just have to put my 2 cents in, Dee Dee, to say I agree so much with your idea that we work in semantics. One of the things I always felt was impactful is we move from saying barriers to challenges. A barrier is a brick wall. A challenge is something you could go around or hit head on and resolve. So I always, every time I hear something about semantics, I always pitch that to folks in the field.
That's great. Thanks, Steve.
Hey, Tamara,
All
this
right.
is
Go ahead, John.
just a couple things. We have a couple trainings coming up. We have the HUD's 2020 guidance on animals and housing on October 6th, the diversion workshop on October 13th, extraordinary dialogue around skills to lead courageous conversations. We've had a lot of that so far. That's going to be October 22nd. And then extraordinary dialogue on race and racism on Thursday, October 29th, a SPDAT workshop on October 27th, a SPDAT forum for a quick refresher or kind of to chat with some SPDAT experts on October 20th. And then don't forget, we have our eviction forum on November 9th and 10th.
With Matthew Desmond as a keynote speaker, which is amazing. Thank you, Joan. All right, anybody else? All right, we are on to item 13, adjournment. Do we have a motion to adjourn the meeting?
Sure, I'll move that, Derek.
Thank you, Eric. Do I have a second?
Second.
Okay, great. Tad second, and I'll proceed with the roll call. Ryan Balch. Eric Cole.
Aye.
Elizabeth DaCosta.
Aye.
Marshall Franklin. Oh, she had to jump off. Samantha Jackson.
Aye.
Thank you. Bruce Liggett.
Aye.
Joan Service.
Aye.
Charles Sullivan.
Aye.
Jackie Taylor.
Aye.
Dee Dee Yazzie Divine.
Aye.
The motion passes.
Hi, I'm here.
Oh, hi, Jackie Taylor. All right, the motion passes. Thank you, everybody. That concludes our meeting. I'll see you next month.
Thanks, everybody. Take care.
Thanks, everyone. Bye.
Bye-bye.